So we're going to go ahead and get started learning the bones of the skeleton. Like I said, we're going to split the bones of the skeleton into two lectures. First being the axial skeleton and the second being the appendicular skeleton. We're going to look at an overview of the skeleton right now with all of our major bones labeled, right? We've got our frontal, parietal, temporal, nasal bone, occipital bone, zygomatics, maxilla, mandible, cervical vertebrae 1 through 7. So that's just this top portion. And as you can see, all of the major bones are labeled. And we're going to be going over all of these over the next two lectures. So part 1, the axial skeleton. We're going to start from the top, or the most superior part of the body, and we're going to start with the cranium and the mandible. The skull is perhaps the most complex element of the skeleton, right? There's a lot of little bones in there that are important to the function of our body. And so we're going to go through each and every one of them. And so the cranium is what we call the skull without the jawbone or the mandible. And this houses many of the key organs of the sense as well as the brain, right? So the sense being the tongue for taste, the olfactory bulbs for smell, and so on. The skull is a major interest to us as biological anthropologists because it's critical in age and sex determinations. It's also a key structure in understanding the evolutionary history of primates. And we'll see this as we continue on in the semester. We're going to see it when we talk about human variation, as well as looking at the craniums of our primate relatives. So the cranium is made up of many smaller bones that fuse together as we grow. So here you can see an overview of the cranium, right? We're going to be going over all of these bones in a little bit, but this is just giving you a first look or a closer look at the bones that we are going to cover. Here you've got a frontal view, right? Then you've got a lateral view. And then you've got a basilar view down here, right? Or a view from the underside. And you'll see the major bones again that they are labeled. So the cranium and the mandible, right? We're going to start there. One of the first bones and the easier bones to look at or to identify is the frontal bone, right? It makes up the most anterior part of the cranium, and it makes up our foreheads and the superior top of our eye orbits. There are a few key landmarks that we can see on the frontal bone, right? The supraorbital foramen, sometimes called the supraorbital notch. You've got the frontal eminences or the frontal bosses, supraorbital margins, and the brow ridge. The frontal bone is one of the largest and thickest of the cranial bones, and we can see that when we look at a cranium and you look at all the other cranial bones. So the supraorbital foramen, it's a small hole above each eye socket, and you can see it right here, right? Where supraorbital, yep. And so what it does is it allows for the blood vessels and nerves to come through. After that, you've got the frontal eminences or the frontal bosses, which are right here. These are paired raises on the bony forehead. So if you feel your forehead and you kind of go towards your hairline, you're going to feel these two bony areas at the top, right? Not your brow ridge, but right above that. Those are your frontal eminences. After that, you've got your supraorbital margins, right? These are the upper edges of your orbits. So right around your eyebrows, if you go ahead and you feel that, or right under them. Then you've got your superciliary arches or your brow ridge, right? And that's this right here. And these are the bony ridges above the orbits, and they're often larger in our males than they are in our females. And this is important, again, when we're talking about sex determination in a cranium. So here you go again is your frontal bone on a model cranium, and you can see that it extends all the way back. So after your frontal bone, we've got our parietal bones. Our parietal bones are posterior to the frontal bone, and they are paired parietal. So there's two of them. There's one on each side, and it forms the superior and lateral sides of the cranium. They've got a few key landmarks, right? They're square-shaped bones, and they're pretty much overall uniform in thickness. They are the largest bones of the brain case. So you can see them here. It's kind of hard to see, but you can see here the suture right here, right? And it goes all the way up. So these are our parietals. They're very square shaped. After our parietal bones, we've got our occipital bones. They form the posterior surface of the base of the skull. They have a few key landmarks, more than our parietal bones, right? So they've got a foramen magnum, you've got our occipital condyles, you've got your hypoglossal canals, nuchal lines, and the external occipital protuberance, right? So the foramen magnum is probably the easiest out of all of these, right? We know it is a large opening through which our brainstem will pass through, and it'll enter into the vertebral column. After that, so I'm going to go to the picture so you can see it. So foramen magnum there. After that, we've got our occipital condyles right here. These two flattened areas right here. They are two projections with oval articular joint surfaces on either side of the foramen magnum, and they articulate with the first cervical vertebra in the neck. So if we were in class, right, I would grab the C1 and I would place it right under the occipital bone, and it fits perfectly with one another. And this is where they sit. Superior to each of the occipital condyles are the hypoglossal canals, right? They're right in here. It's a little hard to see in this picture. The hypoglossal canals are small openings on either side of the foramen magnum, and this allows for the 12th cranial nerves to pass through. And these are important. The 12th cranial nerves are important for innervating the tongue. On the external surface of the occipital, we see the horizontal nuchal lines, right? So you can kind of trace that here. And these are bony ridges to which the neck or the nuchal muscles attach to. Then you've got our external occipital protuberance, which is right up here. I know it's hard to see on this picture. And this is a bump on the midline of the external surface of the occipital. It is highly variable in size, and it's often larger in our males than it is in our females. So after the occipital bone, we will move on. Oh, here's another picture of the cranium on the basilar surface, right? So again, occipital or foramen magnum. Here's your occipital bone, right? You can kind of see the nuchal lines down here, right? So moving on, we've covered the frontal bone, the parietals, and the occipitals. We've kind of gone from anterior to posterior of our cranium. So now we're going to move laterally. So the next bones that make up the brain case, you can say, are the temporal bones. So the temporal bones, they're inferior to our parietal bones, and they are one on each side of the cranium. So you've got two parietals, you've also got two temporal bones, right? So two and two of those, and then one frontal and one occipital. So the temporal bones, they form the upper portion of the jaw joint, and they also house the organs and the delicate bones for hearing. So on the outside of the temporal bones, or the ectocranial surface, you've got the flat smooth area of the bone. This is called the squamous portion. This also articulates superiorly with the parietal bone. Then you've got the zygomatic process. It's a thin projection, and that forms half of the zygomatic arch, which is what we feel as our cheekbones, right? So here's a closer look at the temporal bone, right, on the ectocranial surface. So here's our squamous portion, and you can see that up here it would articulate or make the joint with the parietal bone. Here you can see our zygomatic process, right? It makes up that first half of the zygomatic arch, right? What we feel as our cheekbones. What else? And here's the external acoustic meatus, right? Where our hearing happens. And then this important feature is the mastoid process, which we'll talk about right now. So our zygomatic arches, they form the space for the jaw muscles, and they attach to the mandible below, to the mandible below and the temporal bones above. There's a small depression seen just below the root of the zygomatic process, and this is called the mandibular fossa. All right, so you can see here. So here's our zygomatic process, right? Again, zygomatic process is important because they vary in size depending on a primate's dietary adaptation. So if you remember when we were talking about gorillas and the sagittal crest, when we talked about the zygomatic arches as well, this varies depending on the size of the chewing muscles, so the dietary adaptations that it needs. Then we said the mandibular fossa right here. Small depression just below the root of the zygomatic process, right? This is where the mandible will articulate and it will form the temporomandibular joint during lifetime, right? Just behind this, like I said, is the external acoustic meatus, or the external auditory meatus. Right behind that is the mastoid process. So posterior to the external acoustic meatus is the mastoid process. It's a small bony bump, and if you go and you feel right behind your ear, you can just barely feel it, right? Again, depending. Some people might have it larger, some might have it smaller. It varies by gender, right? So often it is larger in males than it is in females. But just below and behind your ear, you can feel the mastoid process. It's a point of attachment for our neck muscles that rotate, flex, and extend the head, right? So it's a very important bone projection for those muscles. So here we can see a lateral ectocranial view, right? Actually, no, this would be a medial endocranial view, sorry, of the human right temporal bone. So inside you can see the squamous portion, you've got the petrous portion down here, and this is an interior view of the internal acoustic meatus, because now it's on the inside. So on the inside, on the endocranial side, right, this is what we just saw right now, we see the inner petrous portion, right? This is a dense region that encloses the fragile organs and tiny bones for hearing. Petrous just means pyramid. You can kind of see it has like a pyramid shape. I don't know if you can see that very well. So the ear bones, right, they are housed inside this petrous portion. They are called the auditory ossicles. They are the smallest bones in the human body, and they are the malleus, the incus, and the stapes, right? So malleus for hammer, incus for anvil, and stapes for stirrup. The malleus, and it's easy to remember them, malleus, incus, stapes in that order, MIS if you want to, because that's how they are in order in our temporal bone, right? So the malleus is connected straight to the eardrum, which is then connected to the incus and then to the stapes. So again, going from lateral to medial, it'd be malleus first, the incus second, and the stapes third, right? So we're going to take a look at those. Here's another, the both ecto and endocranial surface of the temporal bone. Now we're looking at the malleus and the incus and the stapes, right? They are very, very small. This is magnified quite a bit. They are very, very small. Again, they are the smallest bones in our body. So there's different shapes for each. The malleus kind of looks like a hammer, and the stapes looks like a stirrup, right? So like on a horse saddle, right? It looks like a stirrup. And then the incus is an anvil, right? And the malleus will be triggered by the eardrum, which will trigger the incus, which will trigger the stapes, and it allows for hearing. So the next bone, right? So now we've covered the frontal bone, the two paired parietals, the occipital bone, and the two temporal bones. So we're going to move now to the rest of the cranium, right? So the first bone we're going to talk about is the sphenoid bone. The sphenoid bone is a bat or butterfly shaped bone, and I'm going to move to the picture just so you can see it. It looks like a bat or it looks like a butterfly, right? To me, it kind of looks like both of them, so I go back and forth. But it is inside the cranium. It is quite complex. And then there's a lot of reasons for it being complex, right? The pituitary gland sits on top, and you've got fissures that are important for nerves and blood vessels to go through, right? So it is perhaps the most complex bone of the cranium. It is difficult to see it in its entirety when it is in the skull because it sits deep between the cranial vault and the face bones. So in order to see it in its entirety like this, you would need to de-articulate this cranium, right? You need to actually take it out. But you can see parts of it if you're looking at it through the side of the cranium, or if you're looking inside of the eye orbits, you can see parts of it. It has many small openings that conduct important cranial nerves for the blood vessels and blood vessels for the face. There are 4 basic parts to it. So you've got the pterygoid plates. Let's see. The pterygoid plates, you can only see them from below or from the side of the cranium, right? So here you've got your pterygoid plates. They're paired. These are thin plates of bone, and they serve as sites of muscle attachment. Then you've got the body, right, which is right over here. And this is a substantial portion of the bone lying on the midline. On the body, you've got this saddle-like projection, or depression actually, and it's called the Stella Turkica, and this holds the hormone secreting pituitary gland. So Stella Turkica actually means Turkish saddle, and so the naming for this is because the shape of the Stella Turkica resembles that of a Turkish saddle. And so again, the pituitary gland sits right on top of the Stella Turkica. After that, you've got the 2 greater wings, right? So you've got one here, right? And the 2 greater wings, they're anterior to the temporal bones, and you can see them through the eye orbits. After that, you've got your 2 lesser wings. So one right here and one right here. They are much smaller, and they provide partial support for the anterior of the brain, right? So continuing with the sphenoid, because of its location, it also has 2 other features associated superficially with the eye. You've got the superior orbital fissures, and you've got the optic foramen. So if we go back to the picture, you can see the superior orbital fissures right here. And so these are long fissures between the lesser and the greater wings, and they allow for nerves and blood vessels to connect to the eye. The optic foramen is the opening to the optic canal, and this canal accommodates the optic nerve and blood vessels as they pass to the eye. So these are important for vision. So after the sphenoid, we've got the ethmoid bone. The ethmoid is a small, delicate, cube-shaped bone. It's centered along the midline between the frontal and the sphenoid bones. Due to its position, right, between along the midline and between the frontal and sphenoid bones, it articulates with many other bones in our cranium. So it forms the medial wall of the eye orbits and the roof of the nasal cavity. Several features can be seen in the disarticulated bones. So here we go. You're looking at a picture of the ethmoid bone. So the 2 features are the Cribiform Plate and the Crista Gauling. And so the Cribiform Plate is a horizontal area of bone that forms the roof of the nasal cavity. And what's important about it is that it looks like a sieve, right? So you can see here, kind of a sieve, if you're not familiar with it, is something that you kind of sift flour through, right? So you can see that here. So it looks like a sieve. It has many perforations, and this allows for the olfactory nerves to pass from the nose to the brain. And then the other important feature is the Crista Gauling. And so the Crista Gauling is perpendicular to the Cribiform Plate, and this is where a part of the outer covering of the brain will attach to. So the olfactory bulbs, the organs for smell, they will sit on the Cribiform Plate on either side of the Crista Gauling. So one here and one here, right? So these are 2 important features of the Cribiform Plate. So here we go again. We're looking at the anterior part of the cranium, right? Frontal bone, our temporal bone, parietal. We haven't really talked about the nasal bones yet. Those will come later. And the zygomatic and that. And you can see here, so here and on the other side, on this side, right? You can see from the sphenoid the superior orbital fissures, right? So you can see them right through the eye sockets, right? So here we go. We've got a lateral view of the cranium. Again, we're looking at the frontal bone. You can see how it goes, starts here, it extends all the way to the back, right? So our forehead probably ends somewhere around here, right? The frontal boss is right here. And then this is where we've, got hair starting, or some of us. And then you've got your parietal bones, right? So you can see large square-shaped bones. Our temporal bone, right, or the squamous portion up here, are articulating with the parietals. Our zygomatic process on the temporal bone, and the mastoid process on the temporal bone. And then back here, it's kind of hard to see, is the occipital bone, right? So I believe, occipital, temporal, parietal, frontal, sphenoid. Oh, here you can see part of the sphenoid bone right here. So you can see that's everything we've talked about so far. So we're going to start talking about the maxilla right now. So after this, okay, you've got a basilar view again. You can see the occipital bone a little bit better here. And you can see part of the sphenoid down here, right? So then again, here are our suture lines, right? This is where our bones articulate. And so these are important to know, right? So we've got a frontal suture up here at the front. You've got and then you've got a coronal suture. So where the frontal bone articulates with our two parietals is called the coronal suture. Here's our parietal bone, parietal bone. Between the two parietal bones is the sagittal suture, right? And then you've got your occipital bone right here, right? And between the occipital bone and the two parietals is the lambdoidal suture, right? And I know I said frontal suture, but ignore that. That's the frontal bone. So again, frontal bone articulating with the two parietals, right? That creates the coronal suture, right? Between the two parietals is our sagittal suture. Between the parietals and the occipital is the lambdoidal suture, right? So you can see here's a posterior view of the cranium, right? Two parietal bones, sagittal suture. Occipital to our parietals is our lambdoidal suture. And here you can see the nuchal line and the mastoid process. So moving on from here, we got the maxillae. And the maxillae it's plural maxillae, and if it's singular, it'll be the maxilla. So the maxillae are a pair of bones that hold the roots of the upper teeth, right? And so if you feel right above your teeth, that's where your maxillae are. They form the face. They form the floor of the nasal cavity and the orbits and the roof of the mouth or the hard palate. They have 4 key features. So I'm going to move to the picture while I describe the 4 key features. You've got your alveolar process. So right here. So these are right over here. Right. The alveolar process is the inferior portion, and that contains the teeth. Right. So if you feel your teeth and then you move a little upwards, right, you're feeling the alveolar process. Next, you've got the zygomatic process, right, superior to the alveolar process. And this forms part of the cheek. And then after that, you've got your palatine process. So the palatine process is on the inside now, right? So right behind your teeth. This forms most of your hard palate and the roof of the nasal cavity. After that, you have your frontal process. So going back to the anterior view, the frontal process. It is a long and thin, and it articulates with the frontal bone and your other facial features. So that goes upwards. So that's our maxillae. Here is a closer view. And then this is the anterior view. And then here you've got a posterior view of it where you can see the palatine process, right? After, and it's called the palatine process because it articulates with the palatine bones. So just like we've got the zygomatic process, it articulates with the zygomatic bones, right? So moving from here, from the maxillae, we're going to see the palatines. And the palatines are these L-shaped bones, right? It's a pair of small L-shaped bones, and they sit just posterior to the palatine processes of the maxillae, right? So you can see they are L-shaped. They form the most posterior part of the hard palate. So the farthest back part of the hard palate. After the palatine bones are the zygomatic bones. The zygomatic bones are a pair of bones that lie between the maxillae and the temporal bones. So again, I'm going to go to the picture while I describe the bones. This is an anterior view of the left zygomatic bone. So the zygomatic bones, again, they are a pair of bones that lie between the maxillae and the temporal bones. They form the most prominent parts of the cheeks. So if you feel your cheekbones, right, you are feeling your zygomatic bones. The temporal process back here will articulate with the temporal bone, and the maxillary process will articulate with the maxilla. If you think about it, right, this maxillary process will articulate with the zygomatic process on the maxilla. So it kind of makes sense. These projections are named after the bone that they articulate with. So if you're looking at the zygomatic bone, it articulates with the temporal, the maxillary, and the frontal bone, right? And so on the temporal and the maxilla, you're going to have zygomatic processes, right? So on the maxilla, you've got the zygomatic processes that articulate with the zygomatic bone. So, then you also have the infraorbital margin, right? And the infraorbital margin forms the lower outside or the inferolateral corner of the orbits, right? So here you go, is your infraorbital margin, right? And so it forms the lower outside of the inferolateral corner of the orbits, right, of the eye. So moving on from the zygomatics, we move on to the nasal bones. So the nasal bones are small rectangular bones, and they lie along the midline just below the frontal bone. So I'm gonna go to a picture of the cranium, right, anterior view of the skull, so we can talk about them. So the nasal bones, right here, you can see them, they are highlighted in purple. They are, again, small rectangular bones, and they lie along the midline just below the frontal bone, right? So here's our frontal bone here, just below that. They form the frontal bridge of the nose, right? So what you feel as really hard, right, before you get to your movable cartilaginous part of your nose, you're feeling the nasal bone. So after that, you've got the vomer, which is right down here. It's really small, and in here it is highlighted yellow. And so the vomer is a thin plow-shaped bone, and it is located in the midline of the nasal cavity, and it forms the inferior part of the nasal septum. After that, we have the inferior nasal concha. So the inferior nasal conchae are a pair of delicate scroll-like bones, and you can see it right here. So there's one right here, there's one right here, right? And they are found inside the nasal cavity, inferior to the ethmoid bone. So let me see if I can find the ethmoid. It's barely visible here, it's pink. But you can see it down here, it projects down behind the, right above the vomer. So here are the plates of the ethmoid. But the inferior nasal conchae are inferior to that. So right here, they're in green. they are very important, right? They are very important in moistening the inhaled air. So you can see it here. It's delicate and scroll-like. So their function is to moisten the air that we breathe in, right? You can see it here. It's a better view, right? It's an inferolateral wall of the nasal cavity, and you can see here the inferior nasal conchae, right? It creates turbulence in the inhaled air, and it is a separate bone, and that turbulence allows for the moistening of that air. So next, after this, is the mandible. So the lower jawbone is, or the mandible, right? It sits below the anterior of the cranium. The primary purpose for the mandible is for chewing. So it holds the lower teeth, and it includes areas for the attachment of our chewing muscles. So we'll go to a picture while I describe everything, all the features of the bone. So again, its primary responsibility is for chewing. So it holds your lower teeth, and it includes the areas for the attachment of our chewing muscles. The main part of the mandible is a horizontal body, right? So the horizontal body right here. It is thick and strong, and it's the reason for it being thick and strong is to support the teeth, right? The vertical ramus, which is right here, it extends upwards on each side of the mandible, and the end of each vertical ramus is marked by a mandibular condyle. So right over here. The mandibular condyle are round processes that articulate with the fossa on the temporal bones, and they make up the temporomandibular joint, or the TMJ. On each side of the mandible, anterior and superior to the vertical ramus, right? So anterior, superior, is the coronoid process. And the coronoid process is this thin, flat, triangular shaped eminence, and this serves as an attachment site for chewing muscles. So our chewing muscles will attach here, and they will extend all the way up and onto our cranium. And as they contract, it brings our mandible up, and then it relaxes, it'll bring it down, right? So it is our attachment for chewing muscles. And then the last thing on the mandible is the protuberance at the midline, right? The protuberance at the midline of the mandible is called the mental protuberance or mental eminence. And this is what we know as the bony chin part on our mandible. All right, so again, we've got the horizontal body right over here. Then you've got your vertical ramus, right? You got it on both sides. Then you've got your mandibular condyle, which articulates with our temporal bone to create the TMJ, or the temporomandibular joint. You got your coronoid process, which is where our chewing muscles attach to. And then you've got your mental protuberance, which makes up our chin. So moving on from the mandible, we have to talk about the sutures. And I kind of introduced them already with the image before. But all of the individual bones of the cranium articulate together by the means of our immovable fibrous joints called sutures. When we are born, the spaces between the sutures are not completely fused, and so it allows for the growth of the brain and the cranium. Right? You want it to be flexible so that our brain can grow. Some of the spaces between these suture joints are so big that there are noticeable soft spots on the superior and posterior surfaces of a baby's head, right? So the top and the back, right? These are called fontanelles. And the fontanelles are cartilaginous they're these soft spots where we have cartilaginous membranes that will eventually grow and they will harden into bone. So each of the sutures have different names, right? So the Metopic Suture or the Frontal Suture, it runs down the center of the frontal bone. And I'm going to show you a cranium of an infant to so you can see where they're located, right? So we've got our Metopic Suture here, right? Usually only found in our juveniles. And so that's the suture that runs down the center of the frontal bone. Then you've got our Sagittal Suture, right back here. This is seen along the midline of the skull between the two parietal bones. And here you can see a fontanelle between the coronal suture or where the coronal suture eventually is made between the parietal bones. After that, so I said sagittal suture. Then you've got your coronal suture right here. So it connects, again, your frontal bone to your parietals. So it's between the frontal bone and the paired parietals. Then you've got your lamboidal suture. And unfortunately, I don't have a picture of the lamboidal suture on the infant cranium. But the lamboidal suture will separate the occipital bone from our two parietal bones. So it is on the posterior portion of the cranium. Then you've got your squamosal suture, which is right over here. You can't really see it very well in this either. But it is the suture between the temporal and the parietal bones. Right, so remember you had that squamosal part on your parietals, and so that is where the squamosal suture is at. Here you also have a zygomatico-maxillary suture, right, between your zygomatics and your maxilla, right? But you don't really need to memorize that one. Just remember your metopic suture, your sagittal suture, coronal suture, lamboidal suture, and your squamosal suture. So moving on from our sutures, now we are out of the cranium until we get to teeth. We will talk about teeth, but that will be after the hyoid. Right, so next is the hyoid bone. And the hyoid bone is a small U-shaped bone suspended in the throat below the cranium. It does not articulate with any other bones, right? So that's what makes the hyoid bone very different from other bones. It does not articulate with any other bones. It does articulate through ligaments with numerous cartilages that form the larynx. And this is involved in the swallowing and speech. All of these areas allow for muscle attachments, right? All these, the main parts we have on the hyoid, right? They allow for muscle attachments that will help move the larynx and the tongue. So the three main parts are the body, the greater horns, and the lesser horns. And I'm going to show you that on the picture of the hyoid bone. So you've got your body, which is the larger central area. You've got your greater horns, which are on the back. These form the posterior ends. And then you've got your lesser horns, which are small projections on the superior surface of the body, right? And all of these are important for the attachments of various muscles to help move the larynx and the tongue. So like I said, we're going to talk about dentition. So the teeth are referred to as the dentition. The dentition that we have relates to our dietary adaptations. And when we talk about our different primates, we're going to talk about the different types of dentition that they have. But for our purposes, just know that our teeth are specific for our dietary adaptations. And this helps because we can use teeth to classify us and our living relatives as well as our fossil relatives, and you can indicate aspects of social behavior. And I know that doesn't make much sense right now, but when we talk about primates and their teeth and their social behavior, it'll make a lot more sense. So the teeth are important because they preserve a lot better than other parts of the body in the fossil record. So what this means is that we often will rely on teeth to identify and understand a fossil species. Each tooth will share the same basic structure of the crown, the neck, and the root. The crown is the area that we see above the gum line. The neck is a constricted area just below the crown. And then the root is the area that extends below the gum line and will anchor the tooth into our mandible. The exterior of the crown is covered by a hard substance called the enamel. And this is the tooth's protective covering. Underneath that is a layer of dentin, right underneath the enamel. And the dentin will contain a slightly higher proportion of organic material than the enamel does. So it is softer and it's more subject to decay. The central area of the tooth is the pulp. And this is a soft tissue that contains nerves and blood vessels. And so you can see it here, right? You've got your crown, you've got the neck, and you've got the root, right? And then going from outside to in, you've got your enamel, you've got your dentin, right? It's here in yellow, and then you've got your pulp right in the inside, right? Here's another picture of a tooth, right? Crown, neck, root. So like most mammals, we have two sets of dentition, right? Oh, here's a closer picture at the tooth. And then here is a closer picture of the tooth also, just not drawn out. So two sets of teeth. So humans have 20 deciduous teeth. They're also called our baby teeth or our milk teeth. They will typically consist of 8 incisors, 4 canines, and 8 molars. We then have another set of 32 teeth, and they grow in and replace the deciduous teeth as we get older. And these are called our permanent teeth. We have 4 types of teeth, and I'm going to go to the picture just to show you because it's easier to visualize them. And also, if you want to run your tongue across your teeth to feel them, or your finger, it really helps to familiarize ourselves with our teeth as we talk about them. So we have 4 types of teeth. We have our incisors, our canines, our premolars, and molars, right? So our incisors are used primarily for biting, and they are spatula shaped. So we've got 4 of them here. And when we're talking about dental formula, we're talking about one quadrant of the mouth, right? So right here or right here. So when I think about dental formula, I automatically say 2, 1, 2, 3 because I think of a human dental formula with 2 incisors, 1 canine, 2 premolars, 3 molars. So I'm going to stick to that for now. So incisors here, right? This is 2 quadrants here, so we've got 4 of them here. Primarily used for biting, and they are spatula shaped. Then you've got our canines, right? So right here, and then on the lowers, right here, and right here. And our canines in some animals, such as our carnivores, are used for shredding. However, in our primates, it's very important to see canines as an indicator for social organization and often sexual dimorphism. So, in our primates, our canines are mostly used to use aggressive threat displays and male competition behaviors, and they're generally cone-shaped. After our canines, we have our premolars, so 2 on this side, 2 on this side, and then 2 on the bottom, 2 on the bottom. And our premolars, also called our bicuspids, they are used for chewing. So a cusp is a projection on the chewing surface of the tooth, and that is actually rounded and slightly pointed. And they're bicuspid because they have 2 of these projections. So 1, 2. Then the last ones are our molars. So 3 molars back here, 3 molars back here, and then 3 up here, 3 up here. And our molars, like our premolars, are used for chewing. They're generally similar to our premolars, but they tend to be larger, squarer, and they have more cusps. So that is our dentition. The next thing we have to talk about, and I know I've already prefaced it a little bit, is the dental formula. So the dental formula is the numerical count of the different tooth types. So to determine a species' dental formula, you have to focus on one quadrant of the mouth, right? So we're going to cut it down the middle right here, and you've got, we're going to talk about left and right this way. So left quadrant here, right quadrant here. So, one quadrant, 2 quadrants. So the dental formula we see different in differing animal species. They have different numbers of each kind of tooth. Species that are closely related tend to have the same number of each kind of tooth, so determining tooth numbers is an important tool that we use in classifications. So to determine a species' dental formula, you focus on one quadrant of the tooth. Many species have the same tooth counts on top and the bottom, so their dental formulas can be simplified to only one set of numbers for the top and the bottom. That's why when we're talking about a human dental formula, we say 2, 1, 2, 3, because it's always 2 incisors, 1 canine, 2 premolars, 3 molars. However, in some species, like we'll see when we talk about some of our primate relatives, specifically like our tarsiers and our lemurs, we'll see that they have differing dental formulas for the upper and lower teeth. So then in that case, both of those have to be reported. So the dental formula for humans and our close primate relatives is 2, 1, 2, 3, right? You can see it here. We write it exactly like this with the periods in between. 2 incisors, 1 canine, 2 premolars, 3 molars. However, if you have had your wisdom teeth removed, or if you never had any, your teeth will not represent the typical dental formula for our species because you will only have 2 molars instead of 3. The wisdom teeth are the third molars, and they're the last to erupt. They usually will come in during your late teens or early 20s. As a species, we tend to have 3 molars in each quadrant of our mouth, but again, they come in later and a lot of people have them removed, right? It's increasingly becoming more common for some people to have them removed, especially if we have access to dental care, right? And usually this is done because there is not enough room in our mouths to accommodate for them. So the next thing, so we are done with the cranium, right? Finishing with dental formulas, we're done with the cranium. And we have to move now inferior to the cranium. So right inferior to the cranium is the vertebral column, right? So the vertebral column is the vertical stack of bones that comprise what we commonly call as our backbone, right? Or our spine. This includes 24 individual vertebrae, the sacrum, and the coccyx. These bones protect the spinal cord as it runs from the base of the cranium to the lower body. In humans, our vertebral column takes an unusual S shape due to the curve in the neck and a curve in the lower back. This is an adaptation that we have to help with our unique form of bipedal movement. And we'll talk about this again when we talk about bipedal adaptations. The vertebrae or vertebra for singular are the irregularly shaped bones that make up most of the vertebral column, and they are separated by our intervertebral discs. And these form cartilaginous joints, and that allows for mobility and will cushion and absorb shock in the spine. So in general, they all share the same basic structures, right? So I'm going to show you. So here is the vertebral column, right? Our C1 through C7, T1 through T12, L1 through L5, and then our sacrum, and then our coccyx. This has 5 elements. These are like vertebrae that have fused together, and then coccyx is 3 to 5, right? That they've fused together. This is our pelvic curve. So you have a cervical curve, our thoracic curve, a lumbar curve, and then a pelvic curve. So we're going to look at the vertebra, right? And so in general, they all share these same basic structures. You've got a large cylindrical area called the body, and it'll extend anteriorly, right? So it'll extend towards the front. And then you've got the vertebral arch, right? So you can see that here, the vertebral arch. It'll extend posteriorly from the body. This arch forms an opening called the vertebral foramen, right here. This is where the spinal cord goes through. On either side of the vertebral arch, there is a transverse processes, and they extend laterally. So you've got one transverse process here, another one on this side. On the posterior surface, back here, on the back side, right, of the vertebral arch, there is a spinous process, and this extends out along the midline. So the spinous process is actually the bumpiness that you see if you bend forward and you bend forward like to touch your feet, right? That the bumps that you feel, you're actually feeling the spinous process. And the spinous process, they help with muscle attachments and or the articulations of other bones, right? So spinous process, right? Transverse process might help with the articulation of other bones, our spinous process for muscle attachments, and so on. So this is a picture of a typical vertebra. This is a thoracic vertebra at a superior view, and it represents a typical human vertebra. So you've got the major bony features that are shared by most of our vertebra. So vertebral foramen, transverse process, our vertebral arch, body, and the spinous process. So we're going to break up the vertebra into the 3 main ones and then go into the sacrum and coccyx. So We first have to start off with our cervical vertebra, C1 through C7. So they are found in the neck and they are the smallest of the vertebra. Each transverse process has a transverse foramen, right? So I'm going to show you a picture of a cervical vertebra. So you can tell between this one and this one, they look very different. So if you remember our transverse processes, this is on a thoracic again or here, but on a cervical, they have a transverse foramen. What is important about this and why we have this transverse foramen is because it allows arteries to pass through the neck and to supply blood and oxygen to the brain. The other thing about our cervical vertebra is that most of them have a short spinous process with a bifurcated or a forked end, meaning that this end splits into two separate branches. The first two cervical vertebrae, and these are the more important, not more important, but the most important, I think, for you guys for memorization and identification, are the first two cervical vertebrae, because they have a specific name and there's a reasoning behind it. So our C1, which I will show you right now. Here's our C1. Our C1 is called the atlas. And it is unlike our other vertebra because it does not have a body. Instead, it has an anterior arch and a posterior arch right here. So it gives it a ring-like shape, having that anterior arch and that posterior arch. Also, it has a superior articular facet right here. It has two on each side. On each of the transverse processes. And this articulates with the protruding occipital condyles at the base of the cranium. So remember I said the occipital condyles, and I would usually in class show you how the occipital bone articulates with the atlas, right? This is where it sits. So the superior articular facets will articulate with the occipital condyles, right? So this is important for movement. The C2, so specifically going back to the C1, so the C1 in the superior articular facet and the occipital condyles, it is what allows the movement of the yes movement. So moving your head up and down, it is movement of the occipital condyles with the superior articular facets. Right, so the C2 then, right, so C1, here's C2. C2 is called the axis, right, so you have your atlas and our axis. The axis has a small body with a perpendicular structure called the odontoid process, or the dens, right here. This extends superiorly, so it goes upwards, and this acts as the pivot on which the atlas will rotate. So the dens and moving superiorly into the atlas, they will work together to allow for head movement and rotation. So that no action of your head going from side to side, it is in the movement or the pivoting of the atlas and the head on the dens. So the way that I remember it is that I remember atlases first is I think of Greek mythology and I think of Atlas, who is in charge of carrying the globe on his shoulders. So I imagine the head as the globe and then Atlas, the Atlas bone, right? Holding the globe on its superior articular facets. If that helps anybody, I hope it does. Other than that, all mammals have 7 vertebrae, no matter how long their necks are, right? So I think specifically of giraffes in that case, because they just have very large C1s through C7 in their necks. So moving on from the cervical vertebra are our thoracic vertebra. And so the thoracic vertebra form the backbone in the chest area, T1 through T12. And they articulate with our ribs. They are a bit larger than the cervical vertebra. They can be distinguished by a few key features. So I'm going to show you a picture of a thoracic first. so I can discuss them a little better. So a few key features. On each side of the body of a typical thoracic vertebra, there are two costal facets. So superior costal facet, inferior costal facet. One being, again, more superior, the other being more inferior. These facets articulate with the heads of the ribs. It's for rib articulation. The spinous process on the thoracic vertebra are unusually long. So the spinous process back here, you can see it a little bit better here. They're unusually long and they're oriented so that they point downward and they will overlap one another. Let me see, you can see a little bit better. Actually, I like the view of both of them. So they overlap one another. The lowest thoracic vertebra, they have spinous processes that are more closely resembling those of our lumbar vertebra. So sometimes it's a little difficult to identify between a lower thoracic and your first lumbar vertebra, but with practice, it gets easier. So just look at this transverse process. It doesn't have holes, so that means it is not a cervical. And then the spinous process here is a lot longer than we will see in a lumbar and in our cervicals. And then you can see the costal facets, right? That is the key point in identifying a thoracic vertebra, is this costal facets, right here. And this is where the ribs will articulate to it. After that is our lumbar vertebrae. So our lumbar vertebrae, they're inferior to the thoracic vertebra, and so they are L1 through L5. They are the largest vertebrae in humans because they support the weight of the upper body. All right, so I'm going to show you a picture. So you can see they are much larger than our thoracics. They support the weight of the upper body. They are relatively generalized and lack the special features that we see in our other vertebra. So they don't have a transverse foramen that we see in our cervical vertebra, and then they don't have the costal facets found in the thoracic vertebra. The other thing that's easy to identify them, other than the large body, is that they have a very short spinous process, a short and blunt one. So that's what makes them easy to identify. So after the lumbar, we've got our sacrum, right? And so the remainder of the vertebral column is made up of two bones, our sacrum and our coccyx. And so the sacrum is a large triangular bone at the base of the vertebral column. So I'm going to show you a picture here. So this is the posterior view of the sacrum, right? So the back, and this is an anterior view of the sacrum. So the sacrum, the sacrum, again, is a large triangular bone at the base of the vertebral column. It curves slightly, creating a concave anterior surface and a convex posterior surface. It has numerous small holes called sacral foramina, and they allow for the passage of nerves and blood vessels. They're comprised of 5 vertebrae that begin fusing together in our teen years, and then they are fully fused in adults. The flared side of the sacrum, the alae or the ala for singular, are formed by the fusion of the transverse processes, and they articulate with the ilia on the pelvis to form the sacroiliac joints. The superior, so here is the alae, right here. You can see it on in a superior view better. And then the superior surface of the sacrum articulates with the last lumbar vertebrae, or the L5, right here. And the inferior surface of the sacrum will articulate with the coccyx. So down here, right? Here's another view. You see our sacral foramina. That's the posterior view. Here's an anterior view of them. You'll still see our sacral foramina. Again, and here's our ala, right? So next is the coccyx. The coccyx is a small bone that anchors a few muscles and ligaments. They are formed by the fusion of 3 to 5 rudimentary vertebrae, and it is known commonly as our tailbone. So here's a picture of it. We commonly call it the tailbone because it is the remnant of the vestigial tail that is lost very early in our embryonic development. On the coccyx, you'll see the cornua. And the cornua project from the superior surface of the coccyx to articulate with the sacrum. Right? It's a very small bone attached to the sacrum. On our class models, usually they just put the sacrum and the coccyx together. They don't separate them. So we've gone through the cranium, we've gone through the vertebral column. All we have left is the ribs and the sternum. So the ribs and the sternum protect the vital organs. The sternum, commonly called the breastbone, is formed by 3 bones that fuse together later in life. So I'm going to show you those. So here's our ribs and our sternum. So here is the 3 bones. So the manubrium, right up here, is the most superior of these bones. It is a triangular shaped bone, and it has a clavicular notch right here, and just on each side to articulate with our clavicles. The other thing it has is a jugular notch. So if you feel right where your clavicles start, or not your clavicle, your sternum starts, you'll feel like an indentation where you can pretty much stick your finger in it, and then it kind of goes up, right? So where that curve is that jugular notch, and then if you move sideways, you're going to be feeling your clavicular notches where it attaches to your clavicles. You'll actually feel your clavicles right next to it. So the jugular notch in the center can be felt, again, just at the base of your throat. Sorry. After that is the sternal body. So we talked about the manubrium. Now the sternal body. And the sternal body is inferior to the manubrium, and it is more elongated and oval shaped. It has costal notches right here. So you can see these costal notches, right? And if you remember costal, think ribs. Costal usually means ribs. And so along each side of the sternal bottom are these costal notches where the ribs will articulate via cartilage, right? They don't articulate, the bone doesn't actually articulate, right? As you can see in this picture, the cartilage, costal cartilage, will articulate with these costal notches. And so that makes up the sternal body. At the very, very bottom is the xiphoid process, and it is most inferior. It is the cartilaginous inferior point of the sternum that later in life becomes mineralized into bone. And so if you're feeling your sternum, right, you go all the way to the bottom, you're going to feel this tiny little bone, right? And I don't suggest you push too hard because it actually hurts if you push on it too hard, but you can kind of feel it. That is your xiphoid process. Again, it is cartilaginous for a while, and then it becomes mineralized into bone later on in life. So that makes up the sternum, right? Remember, it's 3 bones that fuse together: our manubrium, our sternal body, and our xiphoid process. So after the sternum, we have to discuss the ribs. So the ribs, right, we have 24 ribs, and they're arranged in pairs with 12 ribs on each side of our thoracic cage. All of these ribs articulate with the thoracic vertebra posteriorly, but they don't articulate with the sternum anteriorly. Remember, our costal cartilage will then attach to the ribs and then articulate with the costal facets or costal notches on the sternum. So the first 7 pairs of ribs are called our true ribs because they articulate with the sternum directly via the costal cartilage. Right, so I'm going to go back to this picture. So our first 7, our first one here, 2, 3, 4, 5, 6, 7. So they articulate there with the costal cartilage. And then, let's see. Right, so there are true ribs. The next 3 pairs of ribs are called our false ribs because they join with the costal cartilage of the ribs above rather than directly to the sternum. So you can see here 1, 2, and 3, our false ribs. So 1, 2, 3, 4, 5, 6, 7, our true ribs. 1, 2, 3, our false ribs, right? You can see here they are connecting to the cartilage of the rib above, right? So they're not connecting directly to the sternum. And then the last 2 pairs of ribs, they don't connect to the sternum at all. So they are called the floating ribs. right? So if we go back to this picture, you can see here, we've got one here and one back here. And it's hard to see this one. These are floating ribs or false ribs, right? So those are the ribs. So 1, 2, 3, 4, 5, 6, 7, right? True ribs, 1, 2, 3. And then you've got our floating ribs, right? I think there's a miscalculation there. So the rib features, right? So we have to talk about the features of the ribs. They all share the same key features, right? They have a head, they have a tubercle, they have a shaft, right? So the head, to go here, on the posterior end, and it articulates with the body of the thoracic vertebra. So here you can see the head. The tubercle is along the neck of the rib, and they articulate with the transverse process of the same thoracic vertebra. So it's a little hard to see, but here you can see a tubercle kind of sticking out. And then you've got the shaft, which is the main part, right? The main part of the rib. The inferior part of the shaft has a sharp tapering edge. So usually in class I would give everyone a rib to feel, but basically on the superior part you'll feel it rounded, and then the inferior part is a sharp edge, and that's how you can tell if you feel the top and the bottom, and then you flip it, and that's how you can tell if you're looking at a left or a right side of the rib. So you can use that to identify, you can identify the sharp surface, and then from there you can orient the rib correctly to determine if it's from the right or the left side of the thoracic cage. So let's see, here we go. So we have our head, neck, our tubercle, right, that connects to the facets, right, the transverse process of the vertebra. Our head here connecting to the body of the transverse vertebra. And then you've got the shaft, and then you've got a sternal end, right? Sternal meaning the end that will connect via cartilage to the sternum, right? And that's the end of the first part of the skeleton, right? So the next part we'll be talking about the appendicular skeleton. It is a lot easier than the axial skeleton.